Can you see and hear us, Professor Sikora?
Yes, I can. Thank you.
Very good. So you're a professor of medicine at the University of Buckingham. You were formerly the director of the World Health Organization Cancer Programme. And you have become somewhat of a celebrity over the past few months by giving kind of reassuring and somewhat more positive news and commentary on the ongoing crisis. Let's dive straight in. There was a message you put on Twitter a few days ago that caught my eye, where you said that you thought there's a real chance the pandemic might burn out naturally. What did you mean by that?
If you look at the history of pandemics, from the Black Death through to the plague, through to more modern SARS and MERS that we've all experienced in our lifetime, they die out when people say they've died out. Of course, we're living with SARS and MERS, but we're not concerned about them. I feel the same thing will happen to the coronavirus. We will no longer be concerned. At the moment, we're consumed with it. The news is consumed with it. We're obsessed with body counts. Many of the people that have died, sadly, would have died anyway at exactly the same time. We're really quite taken in by the situation of the virus.
What sort of evidence or how should we think about a virus dying out? I mean, in a sense, the policy is predicated on the presumption that if we stop with the social restrictions, it will come back and there'll be a big second spike and so on.
Something's happened over just the last 2 weeks. The infection rate is going down, but the hospitalizations, certainly in the UK, have gone right down, and the deaths have gone right down. I mean, there's lots of little blips in it because of the way the data are counted, but there's no doubt things are getting better all over the world. Europe is opening up now. Austria, the first country to open up on the 14th of April, has had no second wave, no blip in increase, no problems epidemiologically with what's happened. The restaurants and cafes are beginning to open in Italy today, and hopefully there'll be no change. But we're all scared. And the political pressure on the school teachers, on governments to try and sort out should children go back is one of the big discussion points this week. My point of view is that we've got to end the pandemic, and we've got to end the psychology of fear that we've built up for this pandemic. People have to be responsible for their own actions. And as we move forward, I think that's what we're going to see.
But do you think there's a chance that as we gradually release restrictions, we don't see a second spike and we can actually return not to some sort of new normal where we continue social distancing in perpetuity, but actually just the old normal?
I hope so. I really hope so. And when you look at second waves, WHO and, in fact, our NHS in Britain have predicted a second wave for September, and then whatever we do, and then after that we get what's called winter pressures, which is the code for old people flooding hospitals with chest infections, and it happens every winter since I've been a doctor. And there's no doubt that the combination of a second wave, a significant second wave, and winter pressures could completely flood the NHS again. It didn't get flooded in April when it was supposed to. It managed to cope really well. The Nightingale hospitals were left essentially empty. They opened the one in London just as a token to show it could be done. A few patients were treated there, but it certainly wasn't a necessary implementation. As we move forward, it's clear that if there's no rise in the cases as the R0 comes up to 1, they may never come. There's no doubt the problem we've got is fear of what could happen, fear to protect healthcare systems, fear that could actually kill more people because people, my specialty, cancer, are just not coming forward. The cancer patients have disappeared from April, and it looks as though they're still keeping away in May. We've got to get them back. It's not just the patient's fault, it's the system unable to do the diagnostic procedures to label them as having cancer. But we've got to get that moving.
You took part in a group that came up with an estimate of potential additional deaths or avoidable deaths that we might see through untreated cancer patients. And that number was 50,000. Is that something you stand by now? Do you think it's grown or shrunk since you made that estimate?
Absolutely. That was predicated on a delay of 6 months. In other words, if we go on like this for 6 months, what we would see is upward stage migration. That means that a cancer that's stage 1 that has a good outcome would move to stage 2 or 3 by spreading to lymph nodes. It doesn't matter where the cancer is, breast, lung, colon, and prostate are the 4 common cancers. They'd all do the same. They'd spread. And as they spread, the treatment to get best results gets more complicated, it gets more expensive, it involves more chemotherapy, more radiotherapy than would be needed for an earlier stage cancer. So that migration of stage is a disaster. If you take stage 1 or 2 breast cancer, currently 95% of women with those 2 stages will survive 5 years and are essentially cured of their cancer. If it moves to stage 3, the figure drops to only 25%, and that's with optimal care. Right. The other problem we've got is when the brakes are taken off the health service, we'll see a surge of cancer, we'll see a surge of heart disease, a surge of mental health problems, and we'll have to do some sort of triage and rationing to deal with people in an orderly way. And that's coming later on this summer, almost certainly. Now's the time, of course, and maybe you could say we're too late. We should have done it a couple of weeks back. As we come out of lockdown, let's get the hospitals working again. The whole machinery, it doesn't matter whether it's private or public hospitals, let's get the machinery back up to speed.
We've started to get some serology or antibody test results from around the world. There's been some from New York, which show anything upwards of 20 or 25% within New York City have antibodies. But then we have results from Spain, which show a very small percentage of people, maybe 4 or 5%, showing antibodies for COVID-19. What's your reading of that? Does that mean that only those percentages of people have had the disease, or might it be a larger percentage or smaller, or what should we make of that?
I think there are other immune mechanisms. We tested our own staff, about 200 people, and just like in Spain, the incidence of antibodies is less than 10%, which is surprising. I thought it'd be about 30%. We've done it twice at 4 weeks apart, and even last week, the testing showed the same thing, less than 10%, so it's not gone up, which implies there may be other mechanisms involved in the immune defense against COVID, the virus. And those could be cell factors that you don't measure by the antibodies. It also could be local antibodies in the mucosa of the nose and the back of the throat that kick the virus out before it actually mounts an antibody response that you test with a kit. So it's great to get information. What it means for an individual patient is not clear. But
because at the moment, those tests are basically being treated as a sort of fact of what percentage of people have had the disease. So we have results imminently coming from the UK, and there's sort of early rumours that it might be around 10% of the population, or between 6 and 7 million, who are showing antibodies. This is the new ongoing ONS and Oxford University study. When those results come out, you're saying that we shouldn't necessarily think that it's only that group that have had COVID.
Exactly, because of the other mechanisms. So young people, especially children, are behaving differently. It's not really affecting children. I know there's some problems and there have been childhood deaths, which is really sad, but on the whole, it doesn't affect children under 10. So really a puzzle. Why should that be? And one thing could be happening is the children have a very powerful immune system that just gobbles up the virus before it can actually mount an antibody response. So the children certainly in the study in New York had a very low level of antibody production. The fundamental question is exactly what you asked. What percentage of the population are infected? Because if over 50% already are, then we have herd immunity, and it'll just definitely peter out very quickly. We don't know where we are. The bottom end, you've got...
Do you have an estimate yourself? I mean, what's your estimate?
I think we're running about 25-30%. But it's higher in the very group that's most susceptible. And so the susceptible group, the older and the more vulnerable, it has a much higher percentage. And if that's the case, that may be why we're seeing this complete downturn in the infection rate. I mean, I know social distancing is doing it, but something else has changed. It's not just the social distancing. We've been doing social distancing for, 6-7 weeks now. And so you'd expect a plateau, but no, it's a remarkable downturn. So I think my feeling is the virus is getting tired, and whether it's changing, whether we're changing, but it's a combination of the virus getting tired and herd immunity coming, at least in subsets of the population, and those subsets stop the spread, basically.
This really chimes with an earlier interview we did with a guy called Michael Levitt, he won the Nobel Prize for chemistry, but he's a sort of numbers guy, and he was looking at the curves, at the epidemic curves across the world, and noticing that sort of regardless of what the intervention was, they were only exponential for a very short period, and then they started naturally kind of flattening off. Is what you're saying that there might be, across the world, there might be these other types of immunity that are actually slowing the pace regardless of the kind of government response?
Absolutely. And the problem with these other types of immune mechanisms, they don't leave a measurable footprint. So the antibody is like the footprint in the sand. We know the virus has visited our cancer centers because 10% of people do have the antibodies. They've been infected. Not everybody that gets infected actually has any symptoms at all. So about 50% do, 50% don't, which is a great puzzle. What's the selection process to give you symptoms? And going further, what's the selection process going on to actually make you seriously ill by giving you the lung damage that means you go short of oxygen, you end up in intensive care units. So all these things are puzzles. But what we can see everywhere around the world, if you look at the peaks on worldometer, they're all beginning to fall, more or less at the same time after the whole thing started, which is a real puzzle. There is no explanation for that, other than it's following the pandemics of the past, SARS and MERS and so on. Exactly the same happened there. There was some variation between countries and populations, but eventually everything came back to normal, and we've lived with them. We're living with them now. I bet if we tested your antibody levels, not to the current coronavirus problem, but to the old coronavirus, you'd have antibodies to them, even though you may never know you've been infected with it.
So isn't there a danger then, there's so much talk of the R value, as you said, your grandchildren or your nieces and nephews know about it. Is there not a danger if we focus so much on this R number, which is hard to necessarily know for sure, we might be frightened of small upticks that actually might be quite harmless, and we could be prolonging this period of sort of anxiety beyond what is necessary?
Absolutely. And if we look at other countries, I mean, that's the best message, to look at what's happened in Austria, Czech Republic, Norway, Denmark, Sweden, which has always been unusual in the handling of the crisis, and start looking not just at the R0 number, but the total results of it. And the fact that Sweden's end result is not going to be different to ours. I mean, no lockdown versus lockdown. I think persuasion, what we've done here is a great compromise, I think, in social persuasion. It's left a lot of people too scared. And I think the elderly have been particularly targeted just for being old and being told to lock themselves up for 12 weeks. And that's unrealistic.
So, if we've been sort of overly pessimistic, I mean, you mentioned Sweden, and they seem to be coming out with a similar kind of end result. Once you factor in these potential deaths from, as it were, the lockdown or from closure of hospitals and so on, at some point the intervening measures will be doing more damage than they're helping. Do you think we've passed that point?
I think we have, and I think the psychological damage is really profound. It's making people depressed. It's making them, obviously, the whole employment of people. Jobs are important, not just to earn money, but for self-esteem. And we've taken that away from a lot of people. The whole hospitality industry has collapsed everywhere. Hotels are still shut. Restaurants, obviously, and bars are shut. It's got to get back somehow. And I'm not suggesting we should suddenly say from the 1st of June everything opens up completely normally, but I think we can begin to get back. We can have social distancing. The whole social distancing evidence, it doesn't say 2 meters is necessary, the optimal. 1 meter is probably enough as long as people are responsible, don't come in with a fever and a cough, and not only that, adhere to the 1 meter rigidly. That's the WHO recommendation. How do we get out of here now? The only way is to move slowly and surely, get the schools back, get the nurseries open, Again, when you look at that, the unfairness of the schools is that the people that are suffering most are the people from lower socioeconomic backgrounds. The kids from poor homes don't have computers. They don't have parents that can necessarily help them, as well as the middle-class kids that have everything they want at home, and parents who, with lockdown, have been giving them personal tuition.
Would you like to see more schools opening sooner? Do you think that would be a safe approach?
I think opening schools is absolutely vital to get back a sense of normality. It's a pain with traffic jams, there's meeting and greeting issues at the doors of schools, but we've got to get over that. We've got to get schools back sometime. Some people said, well, that's an irresponsible attitude. But the evidence everywhere is that opening primary schools first and nurseries that go with them seems the first thing you do, because the evidence that young children spread this is almost zero. Austria opened its primary schools way back after Easter, and there's been no increase in the families where the children come from, and that's the way to look at it. The danger of having schools working is that the teachers get it and the parents of other children transmit it to each other parent rather than the children getting it. The other thing that's clear is schools have been open in London and everywhere for key workers' children. And so the children have carried on, and there's been no increase in infection amongst the teachers. So when do we start? Why wait?
Masks, got to ask you, do you think we should all be wearing them? Should we be forced to wear them? Should it be voluntary? What's your view on masks?
I think it's a great British fudge. I like it, the way it's been handled. Basically, it's yes and no. You can choose yourself. The evidence on masks is just not there either way. And so the WHO recommend masks should be worn if you have a cough. But if you have a cough, you shouldn't be going out into a public place. So the mask is not for your protection. It's to protect you giving the virus to someone else by coughing and spluttering and getting that little droplets coming out.
What about when you see people wearing masks walking down the street, or you sometimes see people wearing masks alone in their cars driving around? Do you think that's pointless?
I think it's probably pointless. The only situation I would say, the Uber drivers, the taxi drivers, where you've got different people coming in that back seat, no screen, probably I'd feel more comfortable wearing a mask if I had that job. I don't wear one myself on public transport, but then I think it's an individual decision.
So just to look at the kind of big picture then, as we sum up then, Professor Sikora, I mean, you've had a long career in medicine, been involved in the World Health Organization. Why do you think it is that the response to this outbreak has been so different from previous pandemics? We had swine flu ended up killing, by according to official figures, between 500,000 and 600,000 people, but there was no shutdowns, no massive sort of focus on it in the same way. What do you think has happened in this instance?
I think it's fear. Society is afraid. It's been scared totally by governments at the beginning of it, not just the British government, all across the board.
Do you think when we look back at this in the history books in decades to come, it will be more the virus or more the associated fear that will have caused more damage?
The fear is going to cause the damage, not the virus. The virus will go, like all these viruses. It'll disappear. Some people say it just fades away. It doesn't even burn out. There's no sort of catastrophic ending for it. It's not like a war in which you suddenly corner the virus and blow it up. It's just going to fade away, as though it's got bored with this whole advance on society. But society's scarred all over the world, and we'll see it go through political tensions. There'll be reports, reviews, blame culture here. One of the common questions I get asked is, do you agree with government policy? Well, at the time when they had the data, they couldn't see what the future held. And it's so easy retrospectively to say they shouldn't have done this or they should have done something different. And you can score political brownie points, but it's meaningless in reality. What we've got to do is get back to normality just as soon as possible, right across the board.
In recent weeks, we have been talking to a lot of epidemiologists and scientists, trying to understand one big question. Is the coronavirus pandemic a very deadly disease that has only passed through a small fraction of our populations and we need to reorganize our whole societies around protecting from in the future? Or is it a much milder disease that has passed through big chunks of the population and may have done as much damage as it's going to already in sections of those populations. In a sense, the author of that first view is Professor Neil Ferguson. We spoke to him about his Imperial College study. The figurehead of this other view is Professor Sunetra Gupta from the University of Oxford, and I'm delighted that she joins us down the line right now. Hi, Professor Gupta.
Hello.
So it was March the 16th that Neil Ferguson came out with his earth-shattering model that defined government responses to this pandemic. Around about a week later, your group out of Oxford University published a very different model that speculated as much as 50% of the population may have been exposed to the virus already, and that the infection fatality rate may be as low as 0.1%. This caused a big news story, and people sort of started lining up. Either they were University of Oxford people or Imperial College people on this big question of the day. We haven't heard much from you since then, but we have learned some new evidence since March. From what we've seen since, both in the UK with the way that the deaths are gradually reducing, but also from serological studies we've seen in other countries, do you have a kind of updated estimate of where which of those two poles you think the truth is closer to?
It's a bit difficult to conclusively determine what the seroprevalence is. Furthermore, some people may actually be resistant to infection. So to actually get a handle on total exposure might be harder than we think. That said, I believe my own personal view is that while the jury is still out, I would say that it's more likely that the pathogen arrived earlier than we think it did, that it had already substantially spread through the population by the time lockdown was put in place. So his was the worst case scenario, which still remains compatible with the rise in deaths up to that point. And then from that point onwards, what happened would either have to be a result of lockdown, if his model is correct, or if it is still compatible, what happened after lockdown, with the model where the infection fatality rate is low. I think, this is in part an answer to the earlier question you asked, what do we know now that we didn't at the end of March? So in almost every context, we've seen the epidemic grow, turn around, and die away, almost like clockwork. And various countries have had different countries have had different lockdown policies. And yet what we've observed is almost a uniform kind of pattern of behavior, which is highly consistent with the SIR model. To me, that suggests that much of the driving force here was due to the buildup of immunity. I think that's a more parsimonious explanation than one which requires in every country for lockdown or varying degrees of lockdown, including no lockdown, to have had the same effect.
So how can we get to the bottom of this then? It feels no exaggeration to say that it's the most important question in the world right now, because if you're right, and in a lot of these countries the epidemic has passed through and we're actually the other side of it, these sort of ongoing, enormously destructive lockdown policies are a waste and they're a self-inflicted wound in many places. So how can, if we get serological numbers and now we're still not sure whether they represent the true levels of immunity, what steps can we do to actually get a definitive answer?
I think, first of all, we do need to actually do the serological surveys. They're only just taking off. They need to be done properly. We need to have a representative section of the population, and we need to get those numbers. That's the starting point. As you say, it's a little bit worrying that may still not give us the true picture. But then we also need to rely on other indicators. So first of all, the structure of deaths. So who is actually vulnerable? And we do have more information on that now than we had in March. And it's clearer and clearer that the burden of deaths is unfortunately being borne by the elderly and those who have comorbidities or other predisposing conditions. So we need to pay attention to that. And then it also has implications for how to protect the vulnerable and how to move out of lockdown in a way that protects those who are vulnerable to COVID, but also protects those who are vulnerable to lockdown.
So you mentioned the infected fatality rate there. Do you have a kind of estimate of what you think that currently, what we should be expecting that to be?
I think that the epidemic has largely come and is on its way out in this country. So I think it would be less, definitely less than 1 in 1,000, and probably closer to 1 in 10,000.
So that would be 0.01%. Is that
yes,
correct?
well, probably not 0.01, but 0.05.
Right. So if we're talking about like policy now, we've still got this huge sort of area of uncertainty. Clearly, when people talk about the scientists, as you're demonstrating now, disagree. So what does a responsible government approach look like? I mean, they will say we should err on the most cautious, on the most conservative side, and kind of be most cautious about coming out of lockdown. What do you think the approach should be as we go forward?
Well, exactly. So the government's defense even now is that this was a plausible worst case scenario. I agree, it was a plausible or a possible, at least, worst case scenario. The question is, do we or should we act on a possible worst case scenario, given the costs of lockdown? And it seems to me that given that the costs of lockdown are mounting, that case is becoming more and more fragile.
It raises the really sort of worrying prospect that we might actually have made things worse in Western countries like the UK by reacting as strongly as we did. And the obvious example is that we essentially cleared out the hospitals in expectation of this huge wave of incoming patients and ended up accidentally seeding infections in half the care homes in the country. Do you think there's any chance that we might actually have done better had we done nothing at all?
Yes, I think there's a chance we might have done better by doing nothing at all, or at least doing something different, which would have been to protect the vulnerable, to pay attention to protecting the vulnerable, to have thought about protecting the vulnerable 30, 40 years ago when we started cutting hospital beds. So the roots of this go a long, long way back. If we'd had a well-funded National Health Service, which had capacity for this sort of event, I think we would have done a lot better. The other thing to say is that remaining in a state of lockdown is also one which I think is extremely dangerous from the point of view of the vulnerability, of the entire population to new pathogens. So effectively, I think we used to live in a state approximating lockdown 100 years ago. And that was, I believe, what created the conditions for the Spanish flu to come in and kill 50 million people. And that is because what used to happen in that setting, the lockdown setting that we had, with very little international travel, with not as many contacts between people, low density populations, was one where a virus like coronavirus would come in and sweep through and die out, which is what we're trying to get it to do. And what that meant is that if you take influenza, for example, it would come back every 30 years or so, rip through and disappear. But what that means is that every 30 years, there would be a sort of juicy fragment of the population under the age of 30 for the virus to attack. And that is exactly what we want to avoid.
So actually, people being exposed more and being out and about more is better for public health.
I think so, yes.
So the sort of follow-on question for is there a chance things might have been better had we done nothing is there a chance if we go back to normal tomorrow and say, right, lockdown is cancelled, reopen the pubs, reopen the nightclubs, everybody as you were, things might be fine? You know, is that a possibility? And how can we eliminate or prove that possibility?
Well, I think it is a very strong possibility, but as you say, it's not something that one can easily prove. Obviously, the whole drive towards getting the sero epidemiological data was to provide that information on which one could hang such an argument, or if that proved to be wrong, to take alternative measures. But that is proving a little bit difficult. So that is a strong possibility. So what do we do? I think we weigh that strong possibility against the costs of lockdown. I think it's very dangerous to talk about lockdown without recognizing the enormous costs that it has on other vulnerable sectors in the population. So I know there's a sort of libertarian argument for the release of lockdown, and I think it's unfortunate that those of us who feel we should think differently about lockdown have had our voices added to that kind of libertarian harangue. But the truth is that lockdown is a luxury, and it's a luxury that the middle classes are enjoying and higher income countries are enjoying at the expense of the poor, the vulnerable, and the less developed countries. And I think it's a very serious crisis. And to think of it simply in terms of is this epidemic going to be over or not is really unconscionable.
Thank you so much for that. That was Professor Sunetra Gupta of the University of Oxford, who is Professor of Theoretical Epidemiology. She was giving a very different account of the way this pandemic might be taking place. And certainly what she had to say should give our policymakers pause before making big decisions about continuing lockdown for indefinite periods. So thank you to her, and we'll be back in a couple of days' time.